Emily prep question that we had posted last week with our great USMLE counselor and another doctor who's going to help kind of explain and go through the answers with everybody. So would you guys like to introduce yourselves?
Sure. Thank you, everyone. Happy Thursday. My name is Dr. Roland Zhang. I am from St. James School of Medicine. I'm a USMLE counselor. Joining me today is the legendary Dr. Antonetti. Doc, would you care to introduce yourself?
Sure. So I went to school at the Universidad Autónoma de Guadalajara in Mexico, and I am interested in pathology, and I founded a Discord server called Networking, and we do stuff like that. It's a great.
So once again, thank you everyone for joining us today. Today we're talking about a 17-year-old female with facial hair. So for those of you who have done this question before, please throw your questions, thoughts, comments in the chat box. But here we go. So the first thing we want to do is look at the question stem, right? So what is the most probable treatment for this patient symptom? So what do we have? We have a 17-year-old female who comes to the clinic with excessive facial hair that's been worsening for the past few months. In the past, she tried to control it by shaving, waxing, epilation. However, it's not working, right? It's just not working. She currently denies alcohol and tobacco use. The patient is not sexually active. Okay, good to know. Minaki was at 13 years of age. However, her menstrual cycle has been irregular ever since. Hey Doc, what are you thinking?
PCOS.
PCOS, okay.
What does PCOS mean for the non-doctor person?
Polycystic. I think that's polycystic ovarian syndrome, if I'm not mistaken. Anybody have Google handy?
So for those of
you guys are so used to the acronyms at this point.
So her last menstrual period was 5 weeks ago. However, she denies being sexually active. She currently takes a multivitamin and an over-the-counter topical ointment for acne. Okay. The patient is trying to exercise regularly and incorporate healthier life choices and lost 1 kg in the past week. Physical exam demonstrates a female with stage 5 tender sexual characteristics. And upon examination, there's coarse, thick hair on the patient's face, chest, and back, and acne in the same area. She also has a really interesting velvety, hyperpigmented section on the back of her neck and bilateral axilla. The patient's current BMI is 27.4 kgs per meters squared, and once again was the most probable treatment for this patient's symptom. So here's a picture or a couple pictures from allure.com of 3 female patients with hirsutism. So as you can see, it's quite noticeable, right? Quite noticeable. At the same time, I want you to be aware of it does seem that all 3 of them are a little bit on the heavier side, and this will come back into play when Dr. Antonetti explains the mechanisms of action. So what is going on? Like Doc was saying and Ms. Megan kindly clarified, the patient has PCOS, polycystic ovarian syndrome. So Dr. Antonetti, do you want to take it away?
Sure. So are we going to go back to the answer choices and those, or what are we doing here?
Yes, sir. I think we'll just talk about the pathophysiology and kind of explain what's going on, and then we can explain how to treat it. Yeah.
Okay, so the hypothalamus, for those of you who are a little rusty on your endocrine, secretes GnRH, which is in a pulsatile manner, and that leads to the anterior pituitary, which secretes LH and FSH, which goes to the ovaries, which make testosterone, estrogen, and progesterone. So in PCOS, that up and down, that pulsatile manner of GnRH is increased. We don't precisely know the cause, but what that does is it causes a high amount of LH and a high amount of nearly a high amount of FSH. So you have high testosterone and high estrogen. The estrogen is going to cause the insulin resistance. The testosterone is going to cause the insulin resistance, which is then going to cause you to gain weight. And in gaining weight, the fat cells are going to cause you to make more estrogen through the adipose, which ultimately lead to a back decreased FSH. So you, when they're going to ask you a question, the H ratio is going to be about 3 to 1. So the cells, they secrete progesterone and they also make testosterone, and the cells secrete estrogen. And if you remember, there's also a tumor of the ovulosa cells that secretes estrogen. So if you can remember that, you can remember the granulosa cell tumor as well, which I think the mnemonic is better called or something like that. So the main takeaways are that you have high estrogen, high testosterone, and high LH, and low progesterone and low FSH. Roland?
No, perfect. Thank you so much. So for those of you who are prepping for your MBMU step 1, even though Dr. Anthony said high or low, also kind of keep in mind, like when they have the arrow questions, which ones are going high. So high would be estrogen, testosterone, LH, GnRH will all be high, the up arrows. The down arrows could be progesterone or FSH. Okay, so perfect. So let's go back to the question. So now that we understand the basic fundamentals of PCOS, what are we trying to do? So once again, we're trying to treat the most probable treatment for his patient's symptom. What is the patient complaining about? Well, she's complaining about facial hair. She's not complaining about insulin. She's not complaining about losing weight. She's not trying to get pregnant. She just wants to get rid of her facial hair. Right? So a couple of medications to use for this is spironolactone and finasteride. Right? So actually, Megan, do you want to see if there are any guesses in the chat box, or has anyone want to kind of give their thoughts of what's the correct answer?
So nobody's posted anything in the question box, but I do remember that for last Thursday, when we had posted the question, a lot of people had said B. Is
B
it?
as in beta?
Yes, B is in beta.
Okay. Okay, so epilation is not correct. Epilation just means the mechanical removal. So, waxing, shaving. And in this case, she has tried epilation before, right? But it's not working. So epilation is more like a mechanical removal, shaving, waxing. In this case, is not sufficient. So B is wrong. Let's go through all the answer choices, right? So what do we know? Like Dr. Anthony was saying, is a hormonal excess. So we need to break that vicious cycle. We need to break this cycle here somehow with a pharmaceutical methodology to prevent all the excess hair. So let's go through the answer choices. So partial agonist at estrogen receptor. This is clomiphene. Dr. Antonelli, do you remember what clomiphene does? Because I am drawing a quick blank. I believe it inhibits estradiol.
Clomiphene?
Yes, sir.
Partial agonist of estrogen inhibits estrogen. Ooh, I don't remember the mechanism. However, in PCOS, we have high estrogen, so there's really no need to inhibit estrogen. Yes. Just logically doesn't make sense.
Yes. So I was looking at my cheat sheet really quick. So basically, estrogen inhibits the action of the hypothalamus. So like Dr. Antonetti was saying earlier, if you prevent that, the hypothalamus does not recognize this excess of estrogen, so it downregulates the amount of GnRH, downregulates the amount of LH and FSH. So the patient's menstrual cycles goes back into order, and it works more for females with PCOS trying to become pregnant. In this case, we don't want that. Well, she doesn't want that. She's complaining about facial hair, not about the fact that she's trying to have a baby. So going back, option A is not the best answer. Option B, also not correct. Once again, mechanical removal not being helpful. Option C, this is danazol. So danazol actually blocks androgen, progesterone, and glucocorticoids. However, one of the major components of danazol is ethisterone. Ethisterone is actually androgen. So even though it could block everything else, causing it, it's actually causing more androgen. So if anything, it will make the hirsutism, the facial hair, even worse. So option C is out. Option D, as in delta, these are aromatase inhibitors, and they actually are used to help convert testosterone to estradiol. Right? The thing is that if you convert testosterone, if you're trying to prevent the conversion of testosterone to estradiol, it's more used for any kind of condition which you're trying to prevent estrogen. So anything you want to prevent estrogen, for example, a estrogen-sensitive breast cancer. In this case, we have a patient with PCOS, not breast cancer, so option D is out. Option E, like Dr. Antonetti was saying earlier, is spironolactone, which is a potassium-sparing diuretic and also a competitive inhibitor of androgen. So basically, it decreases androgen synthesis. And like this picture earlier, if we decrease the amount of androgens, we have a decreased amount of testosterone, we have a decreased amount of facial hair. So going back, option E, answer choice E, is the correct answer. Doc, did I forget anything? Did I cover everything?
Anything
Anything you
to
want to
think.
add?
No, I think this is a good lesson. Unless there's any questions.
So
Do you have any questions from anybody? You can always comment in the side chat bar and we can answer those right away.
If any of you want these slides, please feel free to email Megan. I'm sure she'll send you her contact information. But this is a very simplified slide of the very, very rudimentary basics of PCOS. So long story short, we have hyperandrogens, like too many androgens. So what happens that they cause the insulin resistance? So almost like a type 2 diabetes like effect, right? So the patient will have obesity. And like Dr. Antonetti mentioned earlier, the obesity, you have increased amount of adipose tissue, increased amount of conversion. So all the androgens cause the patient to have a higher BMI, like the patient we had earlier. At the same time, causes the increased LH and FSH, which cause an increased follicle development. So the PCOS, right? Polycystic ovaries, so impaired development of follicles, they become larger and underdeveloped. So if you have that, you also have the ovulation. The patient will complain that I cannot get pregnant. My menstrual cycles are out of order. And then going back to the increased amount of androgens, you have the hirsutism, the acne, maybe some hair loss due to the excess amount of testosterone as well. So that is the basics. Thank you so much. Ms. Megan, Dr. Antonetti, do you want to talk about St. James and FDN?
Ladies
Dr.
first.
Antonetti, do you want to go first?
Ladies first.
Oh, okay. I'll go first. So thank you everybody for joining us for our second live stream. The last time was recorded for Christmas, but we will be doing this every Thursday. We'll come out with a question, and then the following Thursday we'll go live with the answer on Facebook and YouTube. So be sure to come in and check in with us on our social pages on Facebook, Instagram, and LinkedIn to find out the next question next Thursday and answer your comments below.
Doc, do you want to talk about FDM? So while we're waiting for it, Doc, perfect. There you go.
So a Discord server is kind of like a hello. So started FDN, which is Future Doctor Networking, a little over a year. We have almost 3,700 people, but we're basically a community that wants to help people succeed in medicine, whether it be studying for steps or trying to make some connections. It's a great community, and you can find us, I think, just by Googling. We're on Facebook, Reddit, Instagram, Twitter, and
yeah,
I think
can put your link in the comments below.
Perfect. Do you have that link, or do I need to send that to you?
I think we may have it, but we'll double check, and then we can always ask you.
Okay. I'll grab it really quick, but other than that, I'm done. So.
Okay. Well, thank you very much for this very impromptu Thursday webinar question. We try to make these really informal. We do know we have a very wide spectrum of medical students thinking of going to, potential medical students going to medical school, current medical students who hopefully got this question right. And I'm sure attending residents who will probably email me like, you completely butchered everything. So, but thank you everyone for joining. Ms. Megan, there's nothing else. No, wishing everyone a happy Thursday. Please stay safe, and then we will catch you all next time.
Yeah, thank you all for coming. Bye.